Well, we do appreciate you being here to talk to us today, and we wanted to hear from you about the long-term care budget.
Sure.
So when we were looking at the budget, currently we're in state fiscal year 2012, and that will end July, maybe June 30th, and then fiscal year 2013 starts July 1st.
Correct.
So for the nursing home program, when we were looking at the budget, they have a, I don't know if you call it a caseload, but the number of persons served in 2012 was 10,020, and it's projected to stay the same in 2013. But when you look at the projected expenditures, it's 6.6 million less than this year. So on the surface, it looks like maybe is there a potential for rate cut? We just want to know how that would work with the same amount of people, but with less money.
Actually, there are not any anticipated rate cuts as part of the fiscal year 13 budget. It appears there's a decrease in spending from fiscal year 12 to 13, but that is tied to the provider assessment or the quality care assessment. In 12, we were required to pay back the temporary 10% cut that occurred in fiscal year 2010, and that happened. So it's actually flat rates from 12 to 13 and then flat caseloads. So there will not be any anticipated rate cuts at this point.
Well, how about we move on to the home and community-based service, the frail elderly waiver. We heard from the administration, especially when it comes to Medicaid reform. It's very important to you guys to reduce the nursing home utilization rate, which would mean, we presume, moving more people into home and community-based service programs. And so when we were looking at the fiscal year 2013 budget proposal, we saw that for 2013, you're actually designating $1.2 million less than this year. So what is going on with that? How does that match up with your goal?
We do anticipate utilizing the HCBS program more as we move into CanCare. Knowing that the CanCare changes will come 6 months into the fiscal year and will start January 2013. But that'll be a budget neutral difference. So if we have 100 less people in nursing facilities, if we have 9,900 instead of 10,000 approximately that we have in the caseload budget, then we will have 100 more that'll be on the HCBS budget. And because of the spending, the higher spending in the nursing facility average per member month as compared to the HCBS budget, it would actually be less in the total budget. So we decided ultimately to leave the caseloads the same. The difference in spending that you reference on why you see a decrease in the HCBS budget is due to policy changes that we made the last fiscal year in fiscal year 2012. And those two things were a program called Financial Management Services, or FMS, and the second is a program called Electronic Visit Verification Systems, or Authentic Cares is what the product actually that was implemented a week or two ago. With the FMS, that is for, on the HCBS waivers, there are 5 different waivers between SRS and aging where self-directed care is an option, where their caregiver can hire a friend or someone in the community to provide attendant care, housekeeping, those kind of things for them. CMS and the federal government does not allow the state to pay their wages directly to the client, so we go through a fiscal intermediary. In the past, those payroll agents or the fiscal intermediary has received a lump sum that included the wage and the administrative portion that the state gave them, and then they determined how much they were going to pay the worker, and then they would also determine how much they're going to keep as an administrative rate. CMS mandated that we change that system. We thought we agreed with the need for that. There was a lot of fraud that was built within that system with the payroll agent system. As a result, last November of 2011, we went to the program called FMS, and as a part of that, the administrative rate changed from $140 a month per client to $115 a month per client, which is still above what the national average is of $98 a month per client. And that change from $140 to $115 saved the Department on Aging and SRS millions of dollars that was built within the budget. The last budget year, there wasn't a full year, or this budget year we're in now, there wasn't a full year of implementation built into that. Between July and November, we were still within the current system. So as we go into budget year 2013, we're anticipating the full 12 months of that rate change from 140 to 115 as it's implemented. And then the second thing with the electronic visit verification system, or Authentic Care, that was implemented January 16th of this year. Again, that's just that we're anticipating savings by reducing fraud and abuse, but within the HCBS system. The fiscal year 12 budget was built around 6 months of implementation of that. The fiscal year 13 and the governor's recommended budgets a full 12 months of savings from that program. So the overall spending for our elderly HCBS for our elderly program is down, as you noted. The caseload remains stable for what we have budgeted. The rate that we pay to providers remains stable. So really the reduction in total spending comes from the FMS and the electronic system that we put in place.
Well, my next question would be, discussing rates, is in, I believe it was November 1st, it was supposed to be enacted a 10% rate increase for assisted living, residential health care, and Home Plus providers in the HCBS program to make up for losses they saw after the time standardization for the plans of care. So our question is, are we going to see that 10% rate increase continue on into fiscal year 2013?
We have that 10% rate increase built into the budget. It's really a revenue neutral deal because of the policy changes and the changes of units for the 1,400 HCBS customers that are in assisted living facilities that were impacted by this. So the 10% increase in pay that went into effect November 1st corresponded to the reduction in revenue due to the unit changes and the policy changes. We have forwarded that on in the 2013 budget, and it would continue as we move forward.
Thank you so much for tuning in. This is the first of what we hope will be several more videos throughout the session with different people up here in Topeka and on the Hill. So once again, thank you very much, and we'll see you next time.